Bismillahirrahmanirrahim. Today we will discuss the basics of refractive errors. The normal state of refraction is called emetropia. Emetropia. And if it is ametropia, then it means there is some abnormality or anomaly. Okay, and these are refractive errors, and emetropia is when rays of light, parallel rays of light, they focus on the retina when the accommodation is relaxed and the rays of light are coming from 6 meters and the image is formed inverted on the retina, which in the brain inverts it again and we see the object in its real shape, right? Now there are three types of refractive error. Number one, myopia. Hypermetropia or hyperopia, and third is the astigmatism. These are three refractive errors. There is no fourth refractive error. Now let's briefly learn each of them very briefly. Myopia is also called nearsightedness because in this the rays of light are focused in front of the retina and the patient has to go close to the thing to see. You people must have experienced people who are myopic if they are not wearing the glasses or if they don't know that they have refractive error. Unconsciously, they move closer to television and to bring that focus on the retina. Because what happens in myopia? This is the retina and rays of light are focused here and here is the image is formed. Now this is the cornea and now we have to move this image on the retina. And there are three options. One is placing a minus or concave lens in front of the retina in the form of minus lenses, -2, -3, -4. What will it do? It will diverge the lights which are coming here. Okay? And by diverging, it will make the retina on the make the rays image on the retina. Understood?
Yes, sir.
Understood? Second option is in at the place of concave glasses, you can use contact lenses. which are in close contact with the cornea of various minus lenses numbers, and these are for people who don't want to wear glasses. It's contact, but the mechanism is the same. The contact lenses are made in the way that like glasses -2, -3, -4, and they diffract the light. So when after cornea and lens, when they converge at the right place. Understood? Third option for myopia is the refractive surgery, which is the most common nowadays. The latest is the LASIK and PRK. What we do in LASIK surgery? Basically, Alhamdulillah, I have done my second fellowship after FCPS is in cornea and refractive surgery. So LASIK is my routine procedure which I perform. What we do? It is a 10 minutes painless procedure, and after 12 to 24 hour patient is 6 by 6. In the selected cases, when for whom we have to do, this is the cornea. We place a special keratome, which is automated machine, which makes a flap of a special size on the center. समझ आ रही है?
Yes, sir.
Then this flap is rolled from here to back. This is 12 o'clock. Surgeon is sitting here. Okay? These are feet of the patient, and the flap is now here. And now this is the stroma of the cornea. Epithelium is removed. Epithelial flap is formed by a keratome, and then manually surgeon displaces it, but it is attached at the hinge. We do not torn it. If it is torn, it's a very drastic complication. So, and at the stoma, we apply laser, examiner laser, by a special machine, by special settings, according to the thickness of the cornea and the number of the patient in doctor spherical or doctor cylinder. With special settings, the machine automatically, its control is in our foot. After doing it, we replace this flap over the stroma. Here it was already attached, and that is it. That the femtoelastic procedure is completed. We instill antibiotic steroid eye drops, and the patient is it is, remember one thing, both eyes are done in the same sitting, unlike cataract. Both eyes are done in the same sitting, and immediately after the procedure, patient doesn't need to wear the glasses, and instantly he can see clear. Not very clear. After it is a procedure, a little blurry. Then with the passage of time, after 4 hours, maybe a mild discomfort, he will be more clearer, and the next day he will be alright. The second procedure, LASIK is the latest and most uh, liked and procedure and mostly attractive for the patient is that the recovery time is very uh, small, only 12 to 24 hours, and you get rid of your glasses, and very attractive for patient, but it's very expensive. And the second procedure is what the in fact we do. The basic mechanism is, this is the cornea. In myopic patient, look at my hand. This is the cornea of a normal patient. In myopic patient, the cornea is slightly more steeper. Okay. So what we do with the examer laser, we flatten it. So reflects light or converges light lesser now. And how much we will do it, we calculate it with special scans before this procedure. The second procedure of laser is PRK. PRK is equally good. This is the cornea, but that was automatic keraton. This is a manual keraton, and we remove the epithelium, and we remove it totally. So now this is the epithelial defect. We have, after anesthetizing, we have cut this part of the epithelium. Now it is a defect in the epithelium. We will apply the same laser, examer laser, on the same machine. We will apply the laser, and then we will apply a bandage contact lens. Bandage contact lens is the lens which is slightly larger than the contact lenses which people wear for their glasses or cosmetics. It is slightly larger than that. It is as a bandage. And in femtolacid, the epithelial flap was acting like a uh, bandage. But in this we have to apply a contact lens from outside, and again this is performed on both eyes. And we take the contact lenses out of the eyes after 7 days. The visual prognosis is the same as in the femtolacid and the PRK, and cost effective, half of the price of the LASIK. Patient who cannot afford the LASIK can go for PRK. The only disadvantage is that for 1 to 2 weeks, patient may have to bear a little bit of discomfort, watering and pain, and otherwise there is no complication. So these are the 3 treatment options of myopia. Now we come to the hypermetropia. Uh, did you people got the insight of myopia?
Yes, sir.
Good enough? Huh?
Yes.
Okay. Hypermetropia is also called farsightedness. In this is the retina and the rays of light are focused behind the retina. So we will place a convex lens +1 +2 by calculating measuring with the retinoscope or autospectrometer, and this lens will converge the rays to bring the image on the retina. First option is the glasses, and second option is the same like contact lenses. But we cannot do laser treatment in hypermetropia. Laser can only be done, refractive surgery can only be done in myopia or -2, 3 or 4 diopter spherical astigmatism. That is also if it is in minus. Okay. For hypermetropia, so far laser is not done. It is in experimental stages, but routinely it is not done. So there are two choices. One is the glasses, and second is the contact. Third, third is the astigmatism. In astigmatism, this is the retina, and in astigmatism, two pointed images are formed. Now it can be myopic astigmatism or it can be hypermetropic astigmatism or it can be mixed astigmatism in which both hypermetropic and myopic factors are present. So, uh, for myopia, for example, simple myopia, as we discussed earlier, it may be corrected by -2 diopter spherical. But if, for example, this is the myopia, that is one line is on the retina and the other line is in front of the retina. It is simple myopia. So, you will have to add cylindrical lenses at special axis. Maybe ये इसको divided by और इस तरह हम करते हैं -2 diopter cylinder at 180 degrees. These are special lenses who are marked with the lines, and the line of axis has no power. The power of the lens which is written on the lens is perpendicular to its axis. समझ आ रही है? And it will, I will, for your easiness, this is the case. This will correct this one and this will correct this one. And when we will go practically on autoref and retinoscopy then and visual acuity, then you will better understand astigmatism. Okay. So this is astigmatism. Now it can it can be the treatment options are glasses. In this case, myopic glasses, which will have spherical and cylindrical components. Second, contact lenses may not be formed if the cylindrical number is more than -1. So contact lenses may also be a limitation. Refractive surgery can be done if cylindrical part is not more than 3 to 4. Okay? And for example, if this is plus and this is behind, then the treatment options are again glasses and contact lenses, provided the number is not more than 1 or 2. ठीक है doctor? Because if you what happen if you make a high number of cylindrical glasses? When you see through the cylindrical glasses, for your understanding, uh, if this is -2 for example, and you are looking through -2, you will see it far or you will see it small if you are normal. If you are not have any refractive error, or if you have refractive error, or you are wearing the glasses, like you people, after glasses you are like other normal people. If you see through -2, you will see this pen as small and far. If you see from -2 cylindrical lenses, you will see this pen tilted like here or here, or according to the position of the lens which we rotate, according to the axis, and where we have to place the axis, it is measured by retinoscopy or autorefractometer according to the position of the second image which is forming. कुछ समझ आई थोड़ी सी? It is a little bit difficult, but we will go in detail when we go deep. Right now, my intention was to tell you the basics of the refractive errors. Thank you very much.